Patellar tendinopathy, or better known as jumper's knee, is an injury to the patellar tendon that kind of encapsulates the kneecap. This majority of the time comes with athletes that may be jumping a lot, such as volleyball players or basketball players. Typically the jumping action, when we come down and we land on the ground, typically that load provides about 2 times the amount of force into that tendon as if we're just normally moving around, walking, things like that. All right, so someone that would present to our office with jumper's knee or patellar tendonitis may be coming in after like a repetitive style of movement, meaning they've been jumping a lot. Like I said, in basketball or volleyball, it requires a lot of jumping up and down. Typically, this injury does revolve around repetitive movements and repetitive load forces into that tendon. So typically, a patient, when they come in to the office, is going to have that pain or discomfort at the base of their kneecap. Most of the time, if they're not doing those style of exercises or jumping a lot or moving repetitively, most of the time this condition will kind of calm down. But the moment that they get back into that physical activity, they're running up and down hills, they're jumping a lot, just some kind of repetitive movement to that tendon will tend to flare this up and make it worse. And that's when they will tend to present to our office with that injury. So in order to treat this condition, we like to utilize a lot of different techniques. This condition tends to like massage or just some kind of myofascial release technique, as well as we'll incorporate some cupping, as well as maybe a little bit of Graston or using the instrument-assisted soft tissue tool. And on top of all that, we'll utilize dry needling as well. So we like to make sure that the quads are working, make sure the quads are moving, making sure they have no tension or tightness or anything like that may affect this tendon and this condition. So a really important part of treating this condition is the manipulation or the chiropractic adjustments to the areas above and below the knee. Typically the knee is a very stable joint, so there shouldn't be a whole lot of movement in the knee itself. So you really have to make sure that the ankle is moving really well and the hips are moving really well, as well as the low back. Because sometimes this may throw off a little bit of your movement pattern or your gait pattern, so that might affect other areas. So we got to make sure that everything's moving like it should be in order to facilitate perfect movement in the knee itself. Now once everything's moving really well, the pain levels are down, then we'll tend to incorporate exercises. Now the exercises are there because we're trying to reload that tissue to better adapt and strengthen that tissue as well, and kind of a better movement pattern. The exercises will tend to kind of start slow because we got to make sure that the inflammation goes away in the tendon, but then we like to build up that with strength training and movement patterns and things like that to kind of just, like I said, reinforce that adaptation of that tissue.
I'd show you all around. If there's anything left in this town.
Your skin looks so funny.
I said the things you want me to might lead to someone else but you.
may have this injury, or you yourself might have this injury if you notice, after playing a game of pickup basketball, give the office a call. We'd love to examine it, take a look, at least help you out a little bit the best way we can. So the number is 513-463-3011, and look forward to seeing you.